Well, COVID-19 was just one of the things that shaped the health sector the previous year. We'll have to look at 2020 and the health sector in retrospect. And to do justice to that, we have with us in the House the Director General of Primary Healthcare Development Agency, in person of Dr. Janet Ekpenyong. Good morning, ma'am.
Good morning, Doctor.
Pleasure to always have you with us. You know, it's been since last year. It's been so long we haven't seen you. We're happy to be here with you. So we're looking at the health sector, COVID-19. We can't avoid that. But before we go into COVID-19, let's look at how Cross River State has fared health-wise, from the numerous campaigns of immunization to the last one, meningitis, that was held just a couple of weeks back. And I think we stand to gain, because there's a heat wave happening right now. It started last week, if I'm not mistaken, and it's still on, even up to the last night. So let's look at how Cross River State has fared through its different immunization campaigns and how we have all benefited.
All right, thank you very much. The year 2020 quite a very interesting year, because a whole lot of things happened. But one of the things that has always been the issue of COVID-19, which actually took a greater part of the year. And for us, it really affected us, because not only the health sector, other sectors were also affected. Because the economy of the states, the entire nation, the world was also affected. But looking at the health sector, remember then when it all started, there was just confusion everywhere, because we tried to really understand what COVID was all about. Then remember then little was really known about COVID, and we all had to. But the good thing is that prior to its arrival into Nigeria, we had started a lot of sensitization and creating awareness. Because remember last year, the beginning of last year, we had Lassa fever, and because of that, we had actually started campaign against Lassa fever then. And when we also heard about COVID, we didn't have to wait until it got to even Africa. We had already started our sensitization, because remember then our borders were still open, and we had to ensure that our people were aware. And I must commend all the entire health team, because I think we did an amazing job of creating that awareness, because almost everyone in our communities were now aware of COVID. But the thing is that initially it almost affected even our services at our health facilities, because we had a very few number of people even patronizing health facilities, and it got to a point where even health workers were even afraid of attending to clients because of fear of contracting COVID. But I must commend the state government, federal government, or even our partners for all the support, because we were given that support. We ensured that we built health workers' capacity, on let them know what COVID was all about, and also on infection prevention control measures. It wasn't just at the state level, we went down to the LGAs, down to the health ward level, and of course the health facilities, to give on-the-spot training, and that kind of built their confidence as well to attend to people, because it actually affected our indices in terms of people who were visiting health facilities, and because of that we also had to bring in some high impact interventions to see how we could bridge that gap, and we had to even bring up outreaches, and with the support of federal government, we had what we call the medical integrated outreach program, to see where we could take these services closer to the people, especially those hard to reach areas, places where people were still contemplating whether to visit health facilities or not, just to build confidence and let them know that these services are still being provided. We've put in all the preventive measures in our facilities to ensure that you can still come into the facilities and be very safe and go back home. And also in terms of our policies, we're able to even enact the infection prevention and control policy in the state, which we thank some of our partners who have supported us, and we've been able to, it's now in all our facilities, all our health, all the health workers now have access to that. They know exactly what to do in case of any further outbreak or just in ways of controlling infection in our facilities. And yes, last year too, we had a lot of campaign because we know that COVID-19 is very dangerous if you already have a compromised immunity, and we had to ensure that we carry out some of those high impact campaigns, immunization, and several other campaigns just to create awareness on how to prevent some of those infections. For instance, we even had the World AIDS Day recently, or last year, where we had to also create awareness and remind people that HIV is still in existence. And of course, if your immunity is already compromised, it makes it even faster for COVID, to cure. We also had campaigns on hepatitis, where we created so much awareness on hepatitis and other infections, and even the recent one we just finished, which is the meningitis, because we knew we're gradually going into that very hot season, like what we're already experiencing now. And we know meningitis it spreads faster during this period, and we had to be very proactive to ensure that we got our children fully immunized, at least to build their immunity against such diseases. But I want to commend His Excellency Senator Professor Benayade, because I remember that when COVID even came, a lot of people took it for granted, where they were not very proactive enough to shut down their borders and all that. But His Excellency had to take the bull by the horn and enforce that lockout, to ensure that people don't come in. Rather, those within try as much as possible to protect themselves. But then I knew there was a lot of backlash, but at the end of the day, they kind of understood why we were doing that, because Cross River State was actually one of the states that tele-recording COVID-19, almost, I think one of the last states also. And that was because of the efforts, because he took the lead, and he did very, very great. I must commend him, and of course, the Honorable Commissioner for that leadership as well, and of course the other entire members of the team. So we just had to do all we needed to do, But the good thing is that there was that awareness, that campaign everywhere, just to make sure that people were aware. And because we are aware, we actually made the right decisions. Because once you're informed, you're bound to make the right decisions, and that really helps a long way. I want to commend all those that have also supported us all through the year 2020, because there's a lot of collaborations. We had to collaborate with even NMA, several other organizations, religious organizations, and other communities, and I must commend them for all their supports, because that helped us tremendously, and we hope that we can do more.
Okay, excellent. Doctor, you superintend over the primary health care, which major mandate is to handle community issues that have to do with the community health wise. Now, how were you able to last year penetrate some very difficult terrains we have, because Cross River State has some very difficult terrains to reach out to in the bit of campaigning? How were you able to go about this to ensure that the people in the local communities get this needed medical information that they should have?
Okay, thank you very much. So the good thing is that we have several platforms that we really leverage on to reach out to as many people as possible, including very hard to reach areas. And even in those hard to reach areas, we even have health facilities, or we have health workers who are all domiciled in those areas. So the good thing is that we had to leverage on our traditional institutions to see how they could lend their voices for our people to make themselves available for those services that we had to render. We had to use town criers, to create that awareness at that level. We also had to even move house to house, because we had health workers. We had a kind of health worker that we called JQ, Junior Community Health Extension Workers, where 70% of their work is actually in the community, and they only spend like 30% of their time in the facility. So they are engaged in community engagement, with the entire community, interfacing with the chiefs, interfacing with the women, and following up to ensure that maybe a pregnant woman comes back for, for antenatal care services, ensuring that the children in those communities receive the necessary immunization, and of course every other services that we have to render in those communities. So they also extend the same gesture to even the very hard to reach areas, because we have facilities that also cover all those areas. So we had to leverage on such platforms. And the good thing is that we also had the media house, because some of those places, we know that we can't reach, you can reach there immediately. So we had to also leverage on your platform to get to as many people as possible. And I want to use the opportunity to really appreciate CRBC, as well as every other media station that has really supported the agency, because that has really helped us extensively.
Yes, and we also want to congratulate you on your first year in office on Saturday. And you tell us how it has been so far, your journey first year, and basically how 2021 looks forward.
So thank you. To God be the glory, and at least we're still standing despite the very challenging year. But we thank God that it's been a very interesting year, progressively, and of course transformatively, in the sense that not just for me, even for my agency, we've had to learn to walk through a pandemic, and we didn't have to fold our hands together because we have COVID. Every other thing needs to suffer. We had to just be very dynamic in our dealings in terms of providing healthcare services. And I want to use this opportunity to really appreciate His Excellency Senator Professor Ben Ayade and his dear wife for all their support and for the opportunity to really give back to my state, and also to support the governments to build the state. And I want to commend all my health workers for the resilience, because most of the achievements we've achieved is not because of me, honestly, because they are the ones really there, and they are giving us all the necessary support. And I really want to commend them and appreciate them. It's been a very wonderful and interesting ride that I'm actually really enjoying. And we know we had started a lot last year. We hope to achieve more this year. At least for this year, we know we are going to begin implementation of our basic healthcare provision funds. We also ensure that we roll out our health insurance scheme this year, and we want to ensure that we renovate and build local facilities, especially those communities that don't have it all. We also want to see how we can bring in more health workers, to help provide those services, because a lot of people, we have a lot of workers that are retired, so there's that huge human resource gap, and we want to ensure that we bridge it. We want to ensure that we get our facilities more equipped, and of course see how we can work together with all the key stakeholders, to ensure that our women no longer patronize TBAs, but first point of call should always be at the healthcare facilities. And we want to see how we can really strengthen and build capacity of our health workers, and we're hoping that we leverage on NMA and several other organizations to help build that capacity. And we just hope that we'll achieve what we want this year.
Thank you so much, Director General, Primary Healthcare Development Agency, Dr. Janet Ekpenyong. We really appreciate how you've given us in-depth rundown analysis of the year 2020 and health exactly, particularly in retrospect. We look forward to carrying us along on all these activities you just outlined for the year 2021. Stay with us. It's still a Good Morning Cross River Show, Monday edition. We'll be right back.